Hello and welcome. Today we're diving deep into a serious medical condition, sepsis-associated acute kidney injury or SAKI. We'll explore what it is, how it develops, and what can be done about it. So, let's get started. SAKI, as the name suggests, is acute kidney injury that occurs in the context of sepsis. Sepsis itself is a life-threatening condition arising from the body's overwhelming and dysregulated response to an infection. A wide range of pathogens can trigger sepsis, including bacteria, viruses, fungi, and even parasites. Common sources of infection leading to sepsis include pneumonia, urinary tract infections, intra-abdominal infections, and skin infections. When the infection spreads, the body's immune system goes into overdrive, releasing inflammatory mediators that damage organs, including the kidneys. The pathophysiology of SAKI is complex and multifactorial. While the exact mechanisms are still being researched, several key processes are believed to contribute. Systemic inflammation is a major driver, leading to widespread endothelial dysfunction, microvascular thrombosis, and impaired blood flow to the kidneys. This reduced blood flow causes ischemia or lack of oxygen to the kidney tissues. The inflammatory mediators also directly damage the kidney cells, particularly the tubular cells responsible for filtering waste. On top of this, sepsis often leads to hypotension or low blood pressure, further compromising kidney perfusion. Some pathogens release toxins that directly injure the kidneys. These factors combine to disrupt the kidney's ability to filter waste and maintain fluid and electrolyte balance, ultimately resulting in acute kidney injury. Sepsis is a significant global health problem, and SAKI is a common and serious complication. Studies suggest that SAKI develops in a substantial proportion of patients with sepsis, ranging from 40% to 7%, depending on the population studied and the diagnostic criteria used. The incidence of SAKI is higher in critically ill patients, those with pre-existing kidney disease, and older adults. The occurrence of SAKI significantly increases the risk of mortality, prolonged hospital stays, and long-term kidney damage. The signs and symptoms of SAKI can be difficult to distinguish from those of sepsis itself. Early symptoms may be subtle, including decreased urine output, swelling in the legs or ankles, and fatigue. As kidney function declines, more noticeable symptoms may appear, such as nausea, vomiting, loss of appetite, shortness of breath, confusion, and seizures. It's important to remember that not all patients with SAKI will experience all of these symptoms, and some may have no noticeable symptoms until the condition is quite advanced. The underlying signs of sepsis, such as fever, increased heart rate, and rapid breathing, are also present. Diagnosis of SAKI typically involves a combination of clinical assessment and laboratory tests. Measuring serum creatinine levels, a waste product normally filtered by the kidneys, is a key indicator. A sudden increase in creatinine from a baseline value suggests kidney injury. Urine output is also carefully monitored, as a decrease can indicate reduced kidney function. Urinalysis may reveal the presence of protein or blood in the urine, further supporting the diagnosis. Blood cultures are often performed to identify the source of infection driving the sepsis. Imaging studies, such as ultrasound or CT scans, may be used to rule out other causes of kidney injury or identify sources of infection. While there aren't strictly defined types of SAKI in the same way as other kidney diseases, it can be classified based on the severity of kidney injury using staging systems like the AKI network, AKI, or Kidney Disease Improving Global Outcomes at DIGO criteria. These systems use creatinine levels and urine output to classify AKI into stages 1, 2, and 3, with stage 3 representing the most severe form. Understanding the stage of SAKI helps guide treatment decisions and predict patient outcomes. The primary goal of treatment and management of SAKI is to address the underlying sepsis and support kidney function. This involves prompt administration of antibiotics to combat the infection, fluid resuscitation to restore blood volume and blood pressure, and vasopressors if needed to maintain adequate perfusion. In many cases, patients with SAKI require kidney replacement therapy, such as dialysis or continuous renal replacement therapy (CRRT), to remove waste products and excess fluid from the body. Supportive care, including nutritional support and management of electrolyte imbalances, is also essential. Minimizing nephrotoxic medications, which can further damage the kidneys, is crucial. Preventing SAKI focuses on preventing sepsis itself. This includes promoting vaccination against common infections, practicing good hygiene to prevent the spread of germs, and promptly treating infections when they occur. For patients at high risk of developing sepsis, such as those with weakened immune systems or chronic illnesses, early recognition and aggressive treatment of infections are particularly important. Hospital protocols aimed at preventing healthcare-associated infections, such as pneumonia and catheter-related infections, can also help reduce the incidence of sepsis and SAKI. The prognosis of SAI depends on several factors, including the severity of the kidney injury, the underlying cause of sepsis, and the patient's overall health. Patients who develop SAKI have a higher mortality rate than those with sepsis alone. Even if patients survive SAKI, they may have an increased risk of developing chronic kidney disease or requiring long-term dialysis. Recent research is focused on identifying biomarkers that can predict development of SAKI early on, allowing for earlier intervention. Scientists are also exploring novel therapies that target the inflammatory pathways involved in SAKI, with the goal of preventing or mitigating kidney damage. Ongoing clinical trials are investigating the effectiveness of these new approaches. Further research is crucial to improving outcomes for patients with this challenging condition.